Okay. So the way that today usually works is I'm going to go through a couple of slides here, tell you a little bit more about our MPhil to PhD program at the Global Business School for Health. If you have any questions, you can either raise your hand or you can put them into the Q&A box. I usually, for screen management, I will usually answer those at the end. So the presentation is usually about 20 minutes or so, 25 minutes. And then I'm more than happy to stay to answer any questions that you may have about this program. So again, today we're going to be talking about the MPhil to PhD program. And so I'm sure that you've done quite a bit of research before coming here today, but just in case you haven't, this is the Global Business School for Health. It is the first business school in the world that has been designed and totally dedicated to educating the next generation of health and healthcare management leaders. This means that health is baked into every aspect of the programs that we do, on top of being a world-leading business school. Our goal is to reimagine what global healthcare management looks like, looking at not just the NHS, not just the UK system, but truly with an international perspective, and to unravel the health challenges from the business perspective. How can we better manage and better organize healthcare in order to provide quality healthcare that's affordable and accessible to everybody? And really seeking to question the status quo within health management. We all know that the healthcare systems around the world have had a number of challenges over the last number of years, understanding who did what well and how can we fix and try to, again, bring healthcare access to everybody. So what is a healthcare management focused research degree? So the goal of this is to help you gain the ability to apply research skills to address health sector challenges. Any of you who have done a master's degree may have done a small project at the end of this. A PhD is now a multi-year in-depth process with a series of in-depth process trying to gain new knowledge and new insights into healthcare. It's aimed to help you reach new heights within your career, within management, consultancy, policy development. It's also for personal and professional development, building self-confidence over research abilities to help solve the problems of tomorrow's healthcare. Research is varied within the departments, and again, with a very international perspective. And it can cover anything from hospital to social care, potentially doing field work, or applied analytics. Doing a PhD with us you would get access to all of our academic expertise, networks, and the interdisciplinarity that comes with it. Having a department of healthcare workers, engineers, social scientists, economists, and management professionals, all at the ability to help support you in your process of completing a research degree within the department. As a department, we also sit within the Faculty of Population Health Science within UCL. This, as a group of departments, is all focused on providing better healthcare from the hospital to business aspects. So a little bit about UCL. Why would you want to come here? UCL is ranked #1 in research power. You see this little logo at the top of the slides here, Ref 2021. So every few years, the United Kingdom does an audit of all the universities in the country on a number of different criteria and ranks them based on their power or their outputs in a number of different factors. So yes, in the last ref, which was 2021, UCL was ranked #1 in London, #2 in the entire UK, with 93% of our outputs being world leading and internationally excellent. So as doing a PhD within our department, on top of having access to all those great resources of world-leading power and output, you also have the opportunity to audit up to 7 modules as part of our Doctor of Business Administration program. This provides research skills and background knowledge that you may need to be successful as a PhD. You also have the ability to work within London and within our state-of-the-art campus that we just built at UCL East, which we will discuss in a couple of slides. So if you're looking at yourself and, are you a typical profile? The students that we have currently doing PhD degrees with us come from a range of backgrounds with a cross-disciplinary interests, all focused in on healthcare. They are exceptional students wishing to pursue careers in research, healthcare management, health services, consultancies within the many organizations around the world. The individuals coming in either have previous master's degrees or have completed an MBA and are looking for the next academic challenge. Both master's degrees and the MBAs do have their small research component, but this is usually a guided project, whereas in a PhD, you are learning how to design and run research projects of your own. PhDs are also aimed at professionals looking to pivot into healthcare from a research management perspective. So a PhD degree, as with most of the UK, is usually a 3-year program if done full-time, or 5 years if done part-time. It is providing cutting-edge applied research and training to the exceptional students that come into it across the healthcare space. Really, the contribution of a PhD or the output is some sort of paradigm shifting change in our understanding or interpretation of the topic that you are hoping to, or that you investigate. The admissions for this program are rolling. Now, generally, people are encouraged to start in September, so applying now would be a start in September of 2023. But admissions are rolling, and there's start dates every couple of months. Positions do have to, or the work is done out of London. These do need to be in-person degrees. These cannot be done remotely. The cost is £5,690 if done full-time, or about half that if it is done part-time. International fees are $26,500 if done full-time, and part-time is only available if you have residency rights within the UK. So what does it actually look like if you are going to be doing a PhD with us? So typically, before you start, you need to come up with an idea for a research project. You go about contacting the faculty members of the Global Business School for Health and finding people that are willing to supervise you and help go through this. You usually need to have a project in play, an idea of a project and methods of how you want to do that prior to contacting the faculty and getting them to sign on to supervising you. We'll also need to work out the provision of necessary equipment or facilities, what is going to be needed in order to supervise this. And once you have a project, this is where working with the mentor will come into place. Usually within the first couple of months of starting your PhD, you refine that project and you come up with a list of experiments that you want to do, the methods you're going to apply, and a timetable. You'll also start to begin your personal development. Now, this can be in the form of those audited modules within the DBA course that I mentioned previously, or any of the other doctoral skills development programs that are offered within UCL. Around 1 year, you should now have begun to start collect data and have a better idea of exactly what do you plan to do and what is your timeline of that. And you start to prepare for what we call a transfer or an upgrade. When you're originally come on to this program, you start off as what we call an MPhil. You then complete some training, you collect the data, you write it up, you come up with a better plan of how you are going to finish, at which point you do an exam, which has both a written and a verbal component to it, where you then become a PhD candidate. From that upgrade that usually occurs somewhere between 12 and 24 months, you then, after you complete that, you then continue your work, continuing the experiments over the timetable that was proposed. You will be meeting with both your supervisors on a regular basis to attend to any challenges that you might face or reasons why you may not be progressing as quickly as possible, or if data is suggesting to switch directions a little bit. At about 30 months, you should be starting to complete your experiments, writing up your dissertation, your thesis, which is aimed to be completed around 36 months. So you are able to do 1 year of what we call completing research student status. During this time, you are still registered as a student, but there are no fees required, and allows you to complete any residual work that might be required in order to successfully complete your PhD. So I talked about developing a research proposal. This is very crucial in order to get engaged with the program and engage with the faculty. The step one is to design a draft research proposal. If you look at the UCL doctoral training program, they have templates for what this is going to look like. This is usually a 2 to 3 page document that is going to be a review of the literature in the area that you want to do. What are the open questions that you want to address? And what are some of the methods that you think would be useful in order to do this? Again, this is a very short overview, sort of an extended executive summary that gets the ball rolling of what you might actually want to accomplish. Once you have an idea with your research proposal, you then start to take a look at the Global Business School for Health staff. This is all under the People page, on our website. You can see what we are and something about what is our research interests and the ideas that we want to do. It also would be good to look us up on, whether it be Web of Science or PubMed, see what sort of publications we have coming out, because that again gives you a good idea of what sort of interests and opportunities we might have as a faculty. Once you have your idea for a proposal and you have an idea of who you might want to contact, reach out to them via email with the draft of your proposal, a CV and a little bit of information about yourself, asking them to take a look at your proposal and work with you to go forward. Once you have a agreed research proposal with your chosen academic, you can then go on UCL's Portico system to fill out an online application. We will then have an interview with a couple of senior members of our team to understand your proposal and whether it's actually viable and feasible in the time allowed before moving into the rest of the research. A couple of application requirements. Students or anyone interested in applying usually needs to have a upper second class degree and a master's degree, including an MBA. In a relevant discipline from the UK or an overseas qualification of similar standards. If they do not have a master's degree, extensive, usually more than 5 years work experience in a research intensive position would be required prior to enrolling in a PhD. Given that communication is essential for this degree, both written and verbal, an IELTS score of 7 or above in all areas, with all areas being above 6.5 is required. Again, communication is essential to be part of this program, and so this is a non-negotiable requirement. Students, anyone interested in becoming a PhD student should be working in the healthcare sector already with some sort of experience, whether it be the master's degree or some sort of work experience and a motivation for continuing to work in the healthcare profession. As I've said, you have the research proposal, 2 references, and an interview in order to proceed. As you go through, so once you're in and as you're working through your PhD degree, you'll have 2 members of academic staff with the expertise and experience needed to support you, and that you'll be working with them to discuss funding options for both the living expenses. Again, these are residential degrees in the UK for 3 to 4 years, as well as any course fees and field work or lab work as required for your completion. There is an expectation before we take you on that there is a reasonable opportunity that you'd have adequate funding for the completion of the entire program prior to your arrival. Applying and then trying to secure funding is not usually supported. So once you're in, UCL's doctoral school, along with our department, the Global Business School for Health, are here to support and guide you through the research journey and the completion of your PhD degree. We have our own welcome sessions as well as a department. The doctoral school centrally within UCL has a number of events across the year for starting new starting students to understand what it's like to be in London, what it's like to be a doctoral student at UCL, and many of the advantages that provides you. There's a number of panels and networking events both within the department and then globally within UCL in order to support you to create the networks needed to be successful in your career after you're done, as well as catalogs of courses and personal development plans that you can use in order to better your academic career and ensure that your success both within the degree and after. And these can be in anything from research skills, technical skills, how to prepare for interviews, how to conduct various types of experiments. So there's a never-ending list of possibilities that you can look into if you are interested in pursuing the degree. As far as the support structures, you will have a principal supervisor, which you should be meeting with regularly. And so they will lead your team and support you in your development and your training, ensure that all legal, ethical, and safety concerns are taken care of along your way. You will have a secondary supervisor and a panel. These are people that you're going to meet with less frequently, usually twice a year, to judge your performance and how you're doing and to provide additional support in ensuring that you're going the correct direction and that everything is being done as well, and to solve any problems that you may not know. The department also has a graduate tutor and a graduate committee that are there to support if there's issues that the primary and subsidiary supervisors are not able to handle. And then obviously there are levels beyond that, including the head of department and the faculty graduate tutor that can resolve any residual issues that cannot be solved by any of the people higher up on that list. So your responsibilities as a research student, the first and foremost is to conduct your research with integrity and quality, carrying out your research according to the regulations of the program and the principles and procedures of UCL's Research Governance Framework and the Research Integrity Framework, which can be found within the UCL's website. Unlike a course degree where you have scheduled classes, PhD degrees are much more student-run. And really keeping track of this is done via the online student research log, and it is your responsibility as a student to use this efficiently, usually with updates every 3 months of what you have accomplished and how you're progressing through your progress. You are able, obviously this is a long slog and it's a very different experience than many other teaching things. Your well-being is important, and there are many structures in place to take care of that along your way, whether it be your supervisory team, the graduate tutor, any issues that may come up can be raised with them, and it's our goal to resolve them as best as we can. Students are also required to undertake about 20 points of extra training during the year. And again, these can be any number of skills, whether it be a technical skill, a research skill, communication skills, writing skills, but you're required to do 20 points worth throughout or each year of your research training. The UCL Doctoral School provides advice to students and supervisors on informal matters concerning the relationship. If there are any strains, this would be one place to go. It's also important to know that as students, you have a lot of support from the UCL Student Union with over 21 groups and societies present that research students can take part in. There's also well-being support in the form of counseling services for mental health, well-being, and disability support that can create tailored programs to your needs, whatever they may be. There's UCL Careers also provides a lot of support, understanding what sort of skills you need to do to be competitive upon completion of your degree, what you need to do as you're going along in order to build up that resume to be competitive, both within and beyond academia. These can include one-on-one advice appointments, workshops, employer events, and also helping identify researcher-specific vacancies and internships that might help you when you get done. And all of this is being provided within London and UCL East, which has been ranked as the top city for students in the UK in 2022. So if you're interested in understanding how you could potentially secure funding for this, there's a number of scholarships available. You may want to, if you're coming from outside the UK, it's important to take a look at what opportunities your country may provide for this sort of advanced funding, or what sort of funding any sort of employer might have in order to build you as a future leader of your department. UCL offers their research excellence scholarships. There are 40 scholarships made available across all of UCL every year. This covers full fees and a stipend for the duration of your study, and some contribution towards research costs. These are incredibly competitive. You can apply as both a prospective or as a current student, but again, counting on getting one of these, as they are exceptionally competitive, is not the best way. Other funding should be understood and secured prior to starting. And as I said, the entry criteria is a 2-1 or equivalent if you are from overseas. So that's a little bit about our research degrees, the MPhil to PhD route. If you're looking for potentially other ways to further your career, we have our executive MBA, our Doctor of Business Administration, and our MBA Health open days coming up over the next several weeks. And so if maybe potentially one of those degrees might be of interest, please do check them out. And obviously all this information is available on the Global Business School for Health event page online. And so with that, I'm happy to take any questions that you might have. I see that there's been too many computer screens here. Okay, so the first question is, how do I know that my research interest fits with my future supervisor? Should I do personal research for that? As the Global Business School of Health, we have a very diverse group of people. Myself, I'm a computer scientist by training. We have chemical engineers, we have physicists, we have research strategy, organizational structure. So there's a large number of research interests within the department. So yes, you should do some research yourself. Sending emails to everyone in the department usually is not a good strategy. Sending an email to a member of the faculty referencing some work that they did that might be of interest and might be relevant would be a good idea of how to do that. The second question is, how do I know that my proposal is approved by the supervisor? So when you draft your original proposal, send it to the supervisors that you think might be of relevance to you. Generally, you will have one or several meetings to discuss the proposal, and there will be a written communication between you and your potential supervisor saying that it is approved. You then go to UCL and the Portico website to actually apply for the PhD, at which point you will then be notified of each step along the application process, ensuring, and you will know and they will tell you when you are accepted. So the next question, the person is studying from abroad. Can they apply from full-time and study remotely? Unfortunately, no. The PhDs in these research degrees within the business school are for full-time residential study. UCL does not offer remote study for PhDs, and our department definitely does not support that. As getting a student visa, there are requirements for being physically present in the UK. And so unfortunately, these degrees do need to be done residential in the UK. So the question is, are there studentships available within the department? This is an ongoing work in progress. We do not currently have any studentships available within our department, but this is something that we are working on. So as a part-time international student, how does working towards a PhD look like? Yes, you do have to be resident within the UK. As with any student visa, you are allowed to do up to 20 hours of work per week. There's quite a bit of postgraduate teaching assistant work that can be available for people that are interested in that. There are paid research positions that are potentially available that can be done on a part-time basis, or you are also able to secure work outside of the school if that's the direction you want to go. So is a life science related master's degree required? No, it is not. It has to be anything relevant to health or business. So a chemistry master's degree would be acceptable as a entry requirement. So the next question is time requirements around doing a PhD part-time as the person is working full-time and live outside London. So as I said, unfortunately, these degrees are residential. So you would have to be spending at least half the time in London in order to complete the degree. In general, part-time is negotiable. It doesn't have to be exactly 50% of your week, but it does need to be a significant part as this is a large body of work. For those who have less flexibility, the DBA program, the Doctor of Business Administration program, has a much lower in UK time requirement than a PhD. The next question is, should I ask my interest whether it's a fits? So my suggestion when the question is about approaching faculty for potential supervision. Having some sort of proposal pre-written, it doesn't necessarily have to be your final one. That you should have something done, some form of proposal written, sort of in the 1 to 2 page area, in order to contact your supervisor to assess whether or not the research project is viable. So the question is, do other programs allow remote doctoral degrees? This is on a department by departmental basis. I'm not sure. I've worked across the life sciences and no one, the life and medical sciences, and no one has. I'm not saying that no one at UCL does, but I'm not sure of who they could be. So the question is about postponing the program to secure scholarships. Once you are accepted, you are able to defer twice at 6 months each. So if you are accepted, you can have a deferred starting date in order to try to secure funding. Okay, that's the list at the end of the questions. Does anyone else have any other questions? Well, if there one last okay, so if there's no other questions, I'm happy to end it here. And okay. Okay, so question that came up is PhD positions that they found under Find a PhD. So Find a PhD is if there is funding secured for a specific program. And so those would follow a very similar route. However, those would be going through so if you find something on Find a PhD, those are usually funded and it would have a similar track of entry and completion of the PhD, but the funding would come from a grant funded by the supervisor. So you would be working for whoever is posting the degree rather than being able to choose your own. So if potential supervisor doesn't respond, there's a number of different reasons to do that. We're all incredibly busy. My suggestion is, yes, resend the proposal. Okay, any other questions? Then I will stop the recording. Oh, okay. How many intakes for each cohort? So these are two different things. So a PhD is not generally a cohort activity. A PhD is a series of research projects that you do as an individual. So intakes, there is an intake into UCL about every 2 months. The UCL doctoral school will say the specific dates that they start. And so individuals start and work through the program at their level. So students do not come in as a cohort. Ideally, if there is a group of people that starts in September, they can work together, but it is not a requirement. So it is not a cohort such as a master's or a doctor of business administration degree. It is very much so an individualistic experience and degree. So you can start whenever you want, and cohorts happen by chance rather than by practice. So if a studentship covers home tuition, can I get other scholarships to cover international fees? So typically, yes. However, there does need to be documentation in place beforehand that if other scholarships are not available, how would you complete the difference between UK and international fees? So yes, you are able to find other scholarships or pay it yourself. Any last questions? Okay, I can stop the recording.